Hi, everyone, in person and online. I see you. My name is Sky. I'm a speech language pathologist here at UCSF, head and neck surgery oncology. I specialize in voice swallowing, and I have a certification and I've done some training for lymphedema in the head and neck region. Thank you, Kara and Dennis, for letting me come and speak to you today. I am from New York, so I speak fast. If I speak too quickly, just raise your hand and let me know so I can slow down. Today, we'll be reviewing a few points. First, I'll be talking a little bit about what the lymphatic system is and what is lymphedema and what are ways to manage lymphedema in the head and neck region. In this talk, I will be integrating some hands-on examples of generalized strategies to minimize lymphedema. It is not intended to replace individualized therapy, and I do recommend obtaining medical clearance before working on manual lymph drainage techniques. If you are willing and able to follow along, whether it's in person here or online, and I invite you to do so. Let's begin by talking a little bit about the lymphatic system. It is part of your immune system, and it is made out of lymph nodes and vessels, and the channels run through our bodies to drain extra fluid and eventually return it to the blood near our heart. Lymph nodes clean and remove waste, as well as viruses, dying cells, foreign matter, and bacteria to fight off infection. The lymphatic system also recycles proteins throughout our body and helps you heal. Lymphedema is a type of swelling that can happen when the lymph fluid is not moving well and there's an interruption to the normal flow within the lymphatic system. It can be congenital in nature, meaning that you are born with it, or it can be caused by tumor or surgical removal of tumor or the lymph nodes by radiation alone or by chemoradiation. In the head and neck region, there's a rich and elaborate lymphatic network of more than 300 nodes and their intermediate channels, with a complex relationship between muscles, nerves, and vessels in this head and neck region. So in short, in those who are going through treatment in this area are at a high risk for lymphedema. While lymphedema can occur in any part of the body in the head and neck region, swelling here can cause discomfort, reduced range of motion, and as well as contribute to functional problems like voice, swallowing, and breathing. And that's why someone like me, a swallowing specialist, might be able to help you with the swelling in this region. Currently, the gold standard for managing lymphedema is called complete decongestive technique. When it comes to head and neck lymphedema, CDT, or complete decongestive technique, includes 5 components: diaphragmatic breathing, exercises and stretching, manual lymphatic drainage, that's the massage component, tissue compression, and skincare. Today, we'll go over briefly the first 3 components of CDT, but we'll not be able to provide a comprehensive talk for each of these individual ones. This will be just briefly, and I hope to give us, we're going to do a couple hands-on for the first 3 components. Now, not all swelling is lymphedema, and it is important to obtain medical clearance from your treating doctor, especially if you're in the middle of treatment or starting this cancer treatment or have a history of infection. Today's hands-on, again, is a general one, and it's not meant to replace therapy. Some common contraindications include an active infection like cellulitis, in which you may feel redness or warmth or localized swelling, and it might be tender to touch, and it could be paired with more traditional signs of infection, such as fevers, chills, and pains. Cardiovascular issues, as well as potential tumor that has not been treated, could also be causing or contributing to the swelling. And as such, it's not all swelling is lymphedema, and so it's really important to work with your providers to assess whether or not CDT is appropriate. Just to review here, the lymphatic system is interconnected with bloodstream and eventually meets the vascular system at the clavicular area right above the collarbone. And so some of the fluids in this area is actually, like some of the fluids drain into the blood, and some of the fluid in blood is lymph fluid. Unlike the vascular system, so here's the bad news about lymphedema. The lymphatic system doesn't have an automatic pump like the vascular system has the heart. So it doesn't pump automatically. The lymph channels are strongly lateralized and they don't really communicate from the right side to the left side of the body very directly. Fluids move through the body through body movement and muscles, mobilizing like a pump, as well as gravity. So while there's bad news that the lymphatic system doesn't have an automatic pump, the good news is that muscle movement and can squeeze in the area to activate the lymph nodes and help the fluids drain in the area, the direction that we want it to. I'm going to stop here for a moment before we go into hands-on and see if there's any questions. I might not answer it right away, but just wanted to see if there's anyone that has any questions so far that I can get to some point during the talk, or if not today, I'll find the answer. Any questions, comments? Mm-hmm. Yeah, the natural fluid or the natural course of where the lymph fluids would flow is interrupted. And so if we think about the fluids like a traffic jam, the fluids that they were normally flow is interrupted. And so we have to find a new route for fluids to drain more efficiently. Yes. Oh, sorry. The question is kind of a confirmation. If you have a lymph node removed, how would that impact swelling in the region? And so if you have a lymph node removed, that natural course of how the fluid drains in your body is interrupted. So you are at risk for fluids collecting and needing guidance to redirect that fluid. Yeah, 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 yeah. Um, I don't know about, that's a really good question. The question is how well we could predict who would benefit from prophylactic lymphedema. And I know that there's no hardcore evidence in terms of preventing lymphedema. Yeah, yeah. I I think it does depend on where and what is involved in the surgery, and that's the area that I might be asking for Dr. Ha's input and advice. Yeah, but I know that the manual, like CDT, doing it prophylactically isn't necessarily well understood or recommended. I do know that I think I met a couple of you before, and there was a question at one of the groups asking, what are some things that patients potentially can do? And so that's what I'm hoping as we go through the hands-on, potentially giving you some tools where you can start integrating some techniques, maybe not exactly manual therapy, but some breathing exercises, some stretches that could potentially help reduce fluids from collecting up here. Thank you. Okay. Um, so that leads me into breathing. So I'm going to start with some diaphragmatic breathing, or also known as belly breathing. This morning, we heard from Dr. Goyle, who did an amazing job sharing with us the experience of mindful breathing. This is similar, and you can probably integrate concepts of the mindful breathing, but for this type of diaphragmatic breathing, the big takeaway is expanding your belly on the inhale and deflating and getting your belly small for the exhale. I was wondering if I stand in front here, will the people online be able to hear me? This one? Testing, testing. Testing, testing. Okay, 1, 2, 3. Okay. I feel like an MC. Okay. so it's okay. It's okay. I'm gonna stand here so everybody can see my belly. And if you're able and willing to do so, I invite you to join in. So I want you to put your hand on your belly. And when you inhale, I want you to feel your belly expand and get big. And then when you exhale, the belly should deflate. We're going to do that 2 more times. Now I want you to shift your hand over towards the right side of your rib. And if you inhale, I want you to feel your rib cage get wide. We're looking for horizontal breathing. And then exhale, the rib cage deflates. How about if you do hands across over towards the other side of the rib? It's a subtle movement. It's small, but you should feel your rib cage get wide and big. And when you feel that expansion, you can even put your hand so you meet a little bit of resistance. Exhale, let the air out. Try not to blow in the. Another technique, so there's different ways of doing this belly breathing, but things that you should be feeling. You should be feeling your chest or your belly, rib cage get wide, horizontal, and then get small. The belly button tries to touch the spine. It's never going to touch. But you're using this as a pump to move air in and out. Another way to do it is borrowing some of the concepts in Tai Chi. You would use your hands and expand it wide on the inhale like this. And then exhale, bring your hand to your mouth and push the air out. So you're visualizing the air filling up your lungs all the way down to your belly. And then sending the air out and forward. Okay. So why are we doing this? Why is this something that is in the realm of lymphedema therapy? So I'm going to play a video here. Oops, did it play? Okay, so you see that pink, red muscle? That's the diaphragm. It's flattening and expanding on the inhale, and then it deflates like a dome and gets smaller on the exhale. It's attached to the rib cage, and then it pumps. It's a huge fan-like muscle, and it's a powerful pump. If we flip the diaphragm up and we're looking from below the diaphragm up, we see that there's this large lymphatic vessel that runs here through the diaphragm. And it's actually the largest lymphatic vessel in our body. So if that channel is pumping and draining well, then there's less likelihood for fluid to kind of collect up top. It still would, because the bad news about lymphedema is that it is chronic, but hopefully I give you some tools that potentially can help this area feel better. And so with this type of belly breathing, you're using your belly as a manual pump so the fluids can drain better lower down. And on top of that, it should feel like your neck is more comfortable, more relaxed, less tight. And so overall, you might feel like there's less pressures up top because you're using your belly to breathe more efficiently. And if you're interested in swallowing, through the diaphragm, the esophagus also goes through it. So that's an interesting part from like a swallowing perspective in terms of digestion. Oftentimes, people will say, well, we need clearance for manual lymph drainage. What are things that we can do prior? Breathing is something that you can always do. You are allowed to breathe. Please breathe. And this breathing, belly breathing, hopefully brings some of the mindfulness practice, but also helps the drainage lower down, the fluids drainage. Okay. Next, let's work on some exercises. Your muscles work as a pump, like we said, and if you activate the muscles and squeeze in the area that we want to stimulate the lymphatic vessels, hopefully we can help reduce fluids collecting up top here. Like I said, movement and gravity helps fluids drain, lymph fluids drain. So any and all exercise in this area is helpful, but hopefully if you sequence the exercise in a specific way, it can help optimize the lymph fluids draining. For instance, if you wake up in the morning and you're puffier and you're more swollen, then exercise and movement in the morning could be helpful for the rest of your day. Because when you're laying down, gravity is not at your advantage, and so there's you're at like higher risk for fluids collecting up top. So now I'll go through a regimen, a routine to help stimulate these muscle activity. We'll start with some neck movement, and I'll stand in the front. This is really nice that so I don't have to go back and look at the screen or what I wrote. But we'll start with some neck movements from right side to left side. And I want you to remember to breathe through it, but you're essentially going to go like this. Right to left. Do 5 more. And then we're going to do some side bending, which is going to be ear to shoulder. So it's going to look like this. Close your eyes. You can keep them open, whatever feels comfortable. You're moving the muscles, loosening up your neck if you're able to. If it's causing pain, don't go far. This is not like a deep stretch. And then we're going to do a neck extension where you're going to kind of look down, tuck your chin, and then roll down, and then flex up to the sky. Now, we don't want to crank your neck up. We don't want to go all the way, but it's going to be a gentle stretch up and down. Oh dear, Kara's giving me the 5 minute. Okay, and then we're going to do a shoulder squeeze. Why do we do shoulder rolls? We're going to skip the chest and scapula. Remembering to breathe. If it's too constricting to do the roll, you can just do like a up and drop down, up and drop down. If there's more tightness because of fibrosis and scar tissue, it might be a little bit of a longer stretch. And you can always put your hands in that area and bring that awareness and mindfulness to the space so that you can breathe and send your breath into that region you want the stretch to go. Okay. Okay, I'm gonna 5 minutes. Let's do this one. Because we heard a lot about trismus. We heard a little bit about trismus this morning, but this is a nice exercise for mouth opening. I like to do this as a warm up for the mouth. Essentially, you're gonna open your mouth wide and then press your lips as much as you can in the front. And so there's a mouth extension and then a lip press. So it looks like this. I like to do this before any oral care. So before you put your toothbrush or your floss, your mouth is already starting to get a little bit of warm up. So there's more room for flexibility. This is not intensive trismus exercise. Again, this is just to mobilize these muscles and use the muscle as a pump so that the fluids don't get stuck here. And then lateralization is going to be from side to side, kind of like a cow chewing on a piece of cud. Or you can do rotation. Okay. And then next, let's talk a little bit about massage. So compared to traditional massage, lymphedema or manual lymph drainage is much lighter. So the pressure you apply is just enough to stretch the skin. And so you can use your hand and touch the skin on your other hand. I'm going to put this one down. You should be able to feel that skin stretch on your hand. There needs to be a little bit of friction, but it's not deep tissue massage where you're getting to the tissue. It's just enough to stretch the skin. And that's because the lymph fluids live below dermis or below the skin and above fat and muscle fascia. So it's if you go deep for deep tissue massage, it might feel good for muscle tension, but not the most effective technique for draining lymph fluid. It's not deep, but it's also not just petting. There needs to be a little bit of friction on the skin. And make sure that you have clean hands so that you're not introducing more bacteria, especially if like you're massaging inside the mouth, because there could be some internal swelling in the mouth and also in the throat area. But for this kind of massage, we're just going to talk about the external piece. But yeah, clean hands and use as much surface on your hands to optimize each stroke. So we want to stimulate the lymph fluids first in the sequence that we want the fluids to drain. And eventually we want it to reach the bloodstream here at the clavicles, right? So this is an area that I like to start with in terms of here at the base of your neck, right above the collarbone, stretching down gently, kind of like there's an L or a J on the two sides of your neck. I usually do opposite side of the hand. And the massage is slow. It's not fast and it's not deep. Okay. And then there's also chest, where you move the fluids from the middle of your chest towards the armpits. And then the armpits, why are we stimulating the armpits? People might find that this part is a little unusual, and it's because the armpit is another area that's rich with lymph nodes. So we want the fluids to drain down, and we want to find the path of least resistance. So the armpit massage is a little bit funky because there's a lot of fatty tissue here, but essentially you're going to stretch the skin. There's a couple ways to do it. Up and in towards where the hair grows, or you can just do circular or C-shaped stimulation here. So you can do it like hand on your waist, like a teapot, like this, or hand behind your head, like this. Making sure that you're breathing as you go along. And then, so now this is part of like chest decongestion. You've done the base of your neck, you've done your chest, you've done your armpit, but chances are this is not the area that you're getting most of the swelling. Most of the swelling is probably up here in the face and the head and neck region. That's where you're going to move back to the head and do more strokes, but you're going to do base of your neck, side of your neck, back of your neck, sometimes even the back of the ear, if you're going through a posterior approach, and then the jaw, the face, and then you do everything in reversed order back down. And then what to do after the manual massage or the lymph drainage, that's when I like to end with more belly breathing. And then skincare. And I don't mean go out, buy a bunch of products. The big item with skincare, it is protect your skin from sun damage, because sun damage can make the lymphatic lymphedema worse. It can also make scar tissue kind of mature. And then compression mask, compression techniques. This was all from the PowerPoint, and I thought it was so cute. Compression, compression is almost always used for lymphedema in any other part of the body, but in the head and neck region, there's a specific challenge, both physically and socially. Today we talked about the first three components of CDT, but there are multiple options for compression, including different masks like the Mirena, Jobst, Solaris, Sigvarius. They range from price point from like $30, $25, $30 all the way to like $400. And then kinesio tape is another option that we have here. You can buy at CVS or Walgreens. And then on the higher end of the spectrum, it's going to be like a pneumatic device where it's a suit that you sit in and you wear, and then it kind of pumps for you. In conclusion, the lymphatic system is part of your immune system and is interconnected with your cardiovascular system. Those experiencing head and neck region treatments are at risk for lymphedema, and complete decongestive techniques include diaphragmatic breathing, exercising and stretching, compression and skincare. And so hopefully I gave you some tips in terms of breathing and stretching and exercise that you can start early. And this is where, like in swallowing therapy, we do teach people prophylactically. We tend to start with stretching with deeper stretches, not so much the movements that I showed you today, but you can kind of play around and adapt different types of exercises. I recommend, again, talking to your treating doctor about when massage in this region would be best.